I would say if you look back at where things were when we ended the last session or ended the last special session, obviously the big game changer that's occurred since then has been Hurricane Irma. And the speaker's been clear that the House will be focused on looking at what response we can provide to help with the recovery and for preparation for our next hurricane. One of the first things he did was put out a request to the members to withhold as much as possible member projects and instead focus those projects on areas that were specific to hurricane recovery and hurricane preparation. He's also appointed a select committee that's chaired by Speaker Nunes, which is working on this very topic. So as we look at what the House will be working on in the upcoming session, I think you have to start with Hurricane Irma and what we can do to help respond and prepare for the next one. The second thing I would say is you've heard about the governor's initiative on the opioid crisis and doing what we can as a state to address that crisis. And that is also going to be a priority in the House. We're going to support those efforts. Chair Jim Boyd has filed House Bill 21. He worked on that issue last year. There's more work to be done, and he is going to lead that effort this year, and that is something that the House will be working on. It's important that we get that work done. If you look at the statistics in Florida last year, in the last year we have the data available, we had over 3,200 drug overdose deaths. Almost 80% of those were specifically tied to opioids. So Chair Boyd has filed a bill to limit the controlled substance prescriptions for Schedule II opioids, limit it to a 3-day supply for acute pain that's associated with surgery, trauma, or other illnesses, and have a 7-day supply if it's medically necessary and if it meets certain restrictions, which you'll see in the bill. Also requires the mandatory use of the prescription drug monitoring program before the prescribing or dispensing of opioids to patients for the first time, and every 90 days after that. It updates the Controlled Substances Act to expand the types of prescriptions that will be reported to the PDMP, the Prescription Drug Monitoring Program, and authorizes state-level enforcement actions on those drugs. So we're going to do what we can from the House to support those efforts and to save lives, because people are dying as a result of this crisis. As we look at specific priorities that the House will be rolling out, I think you could look at the theme would be accessibility, affordability, and accountability. Our initiatives will tie to those themes. Under the theme of accessibility, we've rolled out with Representative Byron Donalds, which I believe was filed yesterday, HB 1, the Hope Scholarship. The belief of that is every child deserves a world-class education. In Florida, last year, more than 47,000 students reported incidents such as battery, hazing, physical attacks, sexual assault, harassment, and bullying. And we know that a number of these incidents never even get reported. And so our goal, as we look at that, is to make sure that students who are exposed to a traumatic event at a school, if it is not resolved to the satisfaction of the parents, that they are given an option to attend a school of their choice, which could be another public traditional school, could be a public charter school, or it could be a private school. But in any case, what we want is the child to be in an environment where they feel safe and secure and can continue their education. The Hope Scholarships will be funded in the GAA in an amount to be determined and will be administered through the Department of Education. Students will be required to take a norm referenced end-of-year exam, and parents will receive a report on their students' progress to ensure that we have the proper accountability. Looking at the theme of accountability, we'll move on to higher education. The Senate will be working on higher education as well. It is our belief that our best students should have the opportunity to continue their education and get a college degree. So to that end, we're supporting the effort, which was contained in the bill that was passed last year, to expand Bright Future scholarships. We believed in the concept that these students should have an opportunity. They proved themselves in high school, and we want our best and our brightest to stay here in Florida and to reach their potential. We'll shift on accessibility to the medical field. This will be no surprise to many of you who have been covering the Florida House of Representatives. We're going to continue to work to increase accessibility in the area of healthcare. We're going to begin with a certificate of need. Although the bill has not been filed yet, we anticipate there will be a bill filed to repeal certificate of need, specifically for hospitals. A certificate of need is a legal document that's required for the proposed acquisition, expansion, or creation of a healthcare facility. Originally, it was intended to prevent the overbuilding and redundancy of healthcare facilities. It was believed this would lower the cost of healthcare. That experiment has failed. Federal government has recognized that it's failed, and they've repealed it. States that are across the spectrum of ideology, from California to Texas, have all repealed certificate of need, yet we still have them here in Florida. So we wanted to engage in free market principles, repeal certificate of need, and let the market dictate where and when hospitals will be built. We believe certificate of need laws are anti-competitive, anti-free market, and they lead to higher healthcare costs for all Floridians. We do know that in certificate of need states, healthcare costs are on average 11% higher than in states that do not require certificate of needs. We believe there's a correlation. And the bottom line is we believe a certificate of need repeal would increase the availability of providers and then create a downward pressure on price because of the increased supply. Continuing on with accessibility in healthcare, we're going to also have a bill filed, HB 37, that deals with direct primary care. Direct primary care is a medical practice model that eliminates the third-party payers from the doctor-patient relationship. A patient or an employer would instead pay a monthly fee to a primary care provider for defined services that the patient could fully utilize at no extra charge. It creates a relationship that eliminates the insurance company, and it empowers the doctor-patient relationship. It's currently illegal in Florida to do direct primary care because the law implies that the doctor is acting like an insurance company. So we believe if you look at other states, there are 23 states that have direct primary care. We believe the model works in those states, and Floridians should have that opportunity as well to reduce paperwork and to strengthen their doctor-patient relationships. Chair Metz is going to be very busy this year. He's also filed the local government ethics reform bill. This bill makes changes to the Florida Code of Ethics for public officers and employees to ensure transparency for local government officers, employees, and lobbyists. This is the four most important parts of his bill. It would require most cities to file full and public disclosures of their financial interests, require board members to annually complete 4 hours of ethics training. This is already required of your constitutional officers and your elected municipal officers. A person who wishes to lobby certain local government entities would be required to register as a lobbyist with the Commissioner of Ethics, and it would require the disclosure of conflicts of interest by locals that cause them to abstain from voting prior to participating in the measure. We believe this is a step in the right direction towards transparency and accountability for local government. Many of these reforms are already in place at the state level, and we believe they work at the state level, and they will continue to work at the local level if we were to do that. As we look at accountability, I have filed a bill that will improve our government and sunshine statutes. Florida, as you know, has been a leader in government and sunshine statutes. If you look at transparency in government, Florida was the state that did it first, and many states have emulated us. What we have seen is in other states, and it's been reported to have occurred a couple of times here in Florida as well, is that public agencies are trying to get around the requirement that they provide public documents by initiating civil actions, civil lawsuits against those who have filed the request. This is done to intimidate people so that they will not file the request for the public document. Under the current law, if you file a request, public agency should either say yes as a public record and provide it to you, or say no, we don't believe this is subject to the Sunshine Law. Then, as the person who has filed the request, you get to make a decision. If you think that they're inaccurate and that it is subject to Sunshine, you can initiate a legal action to get the document. If you were successful, you get the document, and your legal fees are covered by the agency that denied it to you. By having public agencies initiate the lawsuit themselves, it puts the person who has filed the request on the defensive. They have to go to court. They have to pay their attorney fees. And even if they win, they get the public document, but they're stuck with the bill for their attorney fees. That's not right. That's a loophole around our sunshine statutes, and we intend to close it in the Florida House. We also have AOB on the agenda, assignment of benefits. And as you know, that has been an issue in Florida for the last couple of years. It has gotten more attention now that we've had Hurricane Irma come through. We believe it's very important to eliminate the bad actors in this industry. We also believe it's very important to protect the rights of the consumer. So we've got to find a balance that allows us to clamp down on the behavior which drives up the cost and is bad behavior, but do so in a way that protects the rights of the consumers. We thought we found a good balance with the bill the House passed last year. We believe that will be the starting point for what we do this year. And we will see how that bill progresses. The last thing I would say is the House always has a goal of passing a balanced budget and doing so in our constitutionally mandated deadline, which is 60 days. And so obviously that will be a priority for us as well. And with that, I will yield to any questions for the remaining time. Yes, sir. Well, the first thing I would say is that if the actions are true and accurate, they would have occurred before we initiated our rules change, which we did on the first day of session. To my knowledge, there was no complaint that was filed on Representative Pigman. Had there been a complaint filed on Representative Pigman, I believe we would have initiated an investigation and come to a resolution. So to answer your question, there was no complaint filed that I'm aware of. As a result of that, there was no investigation done that I'm aware of. I would say that question would be more appropriate for the speaker since you're questioning the comment that he made. I'm here to talk about the agenda of the House for the next session, and I'm happy to answer any questions on our policy proposals. Yes, sir. What I would say is the speaker was clear in his request to us. His request was that we focus our member projects on hurricane response and hurricane recovery. My suspicion is, as we move forward in the process, the appropriation bills that are going to get hearing are bills that deal with these topics more so than bills that do not. So as far as your question of should members be filing all of these appropriation requests, I would say if they were looking at the clear agenda the speaker has laid out, they probably would not have filed those. But, and I'll add this caveat, I haven't reviewed those projects. I don't know if any of those projects could be tied to hurricane response or recovery. If they could, then they fit within the parameters. If they cannot be fit within those parameters, then clearly those aren't projects that will be viewed as a priority by the House as we move forward. Well, I would begin by making the observation that I haven't been, and I've been through 5 sessions. This will be my sixth. I haven't been through a session yet where everybody's gotten what they wanted. So what I would begin with is saying that just because there's a lot of requests on the table doesn't mean those requests are going to be fulfilled. The other thing I would say is we agree with the governor. We think we have enough revenue in the state to take care of the state's priorities. We believe we need to spend our money wisely, and that's what the appropriations process is for and what the members will be working on. What I can tell you is that there's absolutely no appetite in the Florida House to raise taxes. I'm sure that request will be entertained and we'll look at it, absolutely. I'm not going to commit that we're going to fund anything today because that would not be proper. We have a process that's been set up to determine where funds get appropriated. We'll let that process work. Well, here's what I would say to that. Uh, we agree with the bill that's been filed on the issue of preempting local government on the issue. That's important. 2 sessions ago, the bill, yeah, 2 sessions ago, the bill largely failed over a disagreement over that provision. So the fact that there's now agreement on the issue that this is a statewide matter and not a matter for local government is progress. The issue now becomes, if you're going to take away someone's property rights, you either have to compensate them for that or you have to show an overriding public good. That's part of the reason why every bill that's passed the House has had a requirement for an independent, peer-reviewed scientific study of what the effects would be on Florida's unique geology. Until we have that evidence, I think the likelihood of a fracking ban moving forward is dim. I would say it's accurate to say we share frustration there. I will recognize we appropriated money for the Department of Health to hire more employees because that's critical for them to increase the headcount to accomplish everything we've directed them to accomplish. I have to admit, I agree with the strategy that the director has employed, which is he started with his top level administrators and he's allowing them to build their own teams. So I don't disagree with the strategy, but I think the pace could have been quicker. I would like to see it quicker. I do not agree with the path that they have chosen to take to say that because there's a lawsuit that has been filed, we're not going to issue any of the additional license. I think they could move forward on all of the other licenses and lay aside the ones that are under litigation until the court has provided some direction. So I would say it's accurate to say we share their frustration. We would like to see the process move quicker. Well, the issue becomes we passed that bill in special session, which was in the summer, and we're having our early session, which is January. I'm not sure the bill's actually been implemented for us to determine what we need to go back and tweak yet. So that's not to say there won't be anything done. We'll see if the Senate has an appetite. But I would say our initial position is we would like to see the bill implemented to determine where the weaknesses are that need to go back and be addressed.
Leader, let me ask you to go back just a bit, rewind a bit on medical marijuana, and I know you can't, I don't want to ask you to comment on this pending litigation about what's been called the smoking ban, and that's working its way to the courts right now. What I do want to ask you is, do you foresee any change or thawing in the House caucus's position that medical marijuana should not be smoked?
I do not.
Position on the mandate for nursing homes that and facility facilities that have generators? And if so, if there is a bill in the House that should be a requirement, is there also a bill in the House that we should help pay for those generators? I feel like the industry feels like they should be assisted in the payment of those generators.
Well, I will begin by saying the governor took his action, I believe, to address a crisis that was existing. And so he took the action he felt was necessary to address that crisis. In principle, I believe government exists to protect life, protect liberty, and secure property rights. Clearly, our nursing homes are caring for our individuals who are our most frail and our most vulnerable. So I understand the position the governor has taken in that. We are beyond the crisis now. We're in the mode where we are looking at how we're going to respond and prepare for the next one. And clearly, that's a topic that the House is going to look at. I'm not going to speak for the House on the issue because that's got to go through the process and be vetted through the committees. I do believe we'll see the Special Select Committee on Hurricane Response and Preparedness address that in an upcoming meeting. And so we'll let that process play out.
There's a lot of sentiment in the House that maybe there shouldn't be incentives given to private companies, or tax breaks given to private companies. These nursing homes are private companies that do care for people, including the Medicaid beneficiaries who obviously are paid for in part by the state. But these are private companies. If taxpayers help offset the cost of a nursing home generator, is that not using private? Is that not using taxpayer dollars to help private companies?
I would begin by saying I'm not going to engage in taking a pro or con and defending either side of that issue for the reason I've just stated. It's got to work its way through. But I will make one observation. When you're looking at incentives, which we had the big bill we did in the last session over and we worked on, when I listen to the debate from our members, what our members find most objectionable is giving public money, taxpayer money, to private companies to improve their bottom line at the expense of the public or their competitors, which is inherently unfair. Within this nursing home question, as you said, these are Medicaid patients. Yeah, we do have Medicaid patients in these homes, and this isn't given out in order to promote one business over another, but instead to protect life. And so what I would say to you is that's an issue that the House is going to have to grapple with as we hear this in committee and make our decision as we move forward.
Two more.
I know you don't want to talk about what Speaker Corcoran said specifically when it came to the issues in the Senate. But can you just talk about your own, as the Republican majority leader, do you think lawmakers having affairs with either staff or lobbyists is problematic? And if so, what should be done about it?
I will say, if we go back and look at the first thing we did, we updated our rules. And our rules were updated to say sexual harassment among members is no longer tolerated, although we already had rules against that. Sexual harassment with staff members is not tolerated, and we expanded that rule to include lobbyists. We said members are prohibited from sexually harassing lobbyists as well. I believe all elected officials should hold themselves to the highest ethical standards. When we run for office, we are asking individuals, constituents, to place their trust in us. And it's not just their trust to come up here and be their voice on the House floor when we're voting for bills. It's their trust to come and do the right thing. So what I would say is I find that improper behavior. And that's one of the reasons we have these rules. And I think we have made it very clear. We've done training. We did extensive new member training, and then we ran all of our existing members through the training as well to make it clear that there's behavior that won't be tolerated, and sexual harassment is that behavior.
So I just want to make sure I understand. So do you think the affairs with staff or lobbyists is improper behavior?
If it's consensual.
Consensual. They don't consider harassment. It's a consensual relationship. But do you think it's improper if that consensual relationship happens between an elected official and a staffer or a lobbyist?
I don't think an elected official should be using their position that they have, which is one of power, over anyone who would be in a subordinate position to them, whether that's a staff member who reports to them or a lobbyist whose livelihood depends on the actions that the legislator is going to take in committee or on the floor. So from my personal, you asked me my opinion, I think the behavior is unacceptable, period.
So when you hear about allegations like what Gary mentioned, you're the majority leader, what are you gonna do about it?
Well, what I would say is what he alleged occurred before I was majority leader. Since I've been majority leader, we've updated the rules. We've made it very easy for anyone to report any violations, and we've made it clear that the culture in the House is not going to be one that is accepting of that behavior.
Do you think the Senate has been slow to respond to this risk, and do you think the House has some leverage over the Senate right now because of this?
Well, I would begin by saying I don't think it's proper for me to comment on the actions of the other chamber. I think that they've got, the behavior of their members is something that they deal with themselves. I think that that's the proper way to approach this. As far as leverage, it would be my hope that each policy bill and each appropriation would stand on its own merits as it makes its way through the process. That's the goal we shoot for in the floor of the House. Thank you all.